This Good to Go segment is sponsored by Spectrum Health Medical Group.
Spectrum Health has a long history of excellence in helping patients with joint pain improve their mobility and quality of life. In some cases, that might mean replacing a knee, a hip, or a shoulder joint. And because the surgeries are much less invasive than they used to be, you might not have to spend the night in the hospital. Here to talk about the advancements in joint replacement surgery is Dr. Chris Sherry from Spectrum Health Orthopedics. Dr. Sherry, good to have you here.
Thanks for having me.
Yeah. So
Thank you so
what
much.
is joint replacement surgery?
Joint replacement surgery is a procedure in which we're basically reshaping the ends of the bones to replace them with different materials, generally metal and plastic, in order to resolve any sort of arthritis that's involved in the joints.
Who's a candidate for this kind of surgery?
We look at patients that have severe or bone-on-bone arthritis in their joints. We want them to have failed more conservative measures, things like physical therapy, exercise, weight loss, and joint injections. And once they've failed those type of modalities, they have daily debilitating pain that affect their quality of life. We really start talking about surgical intervention and joint replacement surgery.
Specifically, how is a joint replaced?
So I have a knee model here. We can kind of show you an example here. But really, we're looking at reshaping the ends of the bones of the specific joint. In this case, this would be a knee. If I took this apart here for you, we can talk about that we make geometric cuts that go around the knee joint in order to put prosthetic components. And after the prosthetic components are in place, the arthritis is resolved, and you have a well-functioning, well-moving joint.
Okay, so tell me a little bit about over the last decade or so, how this procedure has changed, because technology has allowed for an upgrade, right?
Absolutely. We're always looking to improve these type of procedures. We've made significant advancements in joint replacement surgery. We're using different components. We're hoping that the components that we're using now are going to last longer for the patients. We're seeing better modes of pain control after surgery to basically limit the amount of pain that you have to improve your recovery. We're also seeing shorter lengths of stay. As we improve pain control, we increase patients' ability to get up and get moving the day of surgery. It allows for us to get the patients home quicker. In a lot of cases now, we've actually moved to outpatient joint replacement surgery, in which patients go home the exact same day that they have surgery.
Wow, that's amazing. Are there other options though before you get to the replacement of a joint? Are there alternatives?
Always alternatives. We really try to start with the more conservative options and really leave surgery as the very last step. For more conservative options, we talk about things like anti-inflammatory medications. We look at exercise or working with a physical therapist to help stretch and strengthen the affected joint. We do joint injections to help reduce inflammation. In certain cases, braces that we can use to help offload the affected area that's affected by the arthritis. Weight loss is always important. We always try to really try all these more conservative modalities first and really leave the surgical intervention as the very last step.
What is life like with a replaced joint? Do folks get back to, normal, so to speak?
For the most part, patients are getting back to normal day-to-day activity, and they're really getting back doing the things they want to do, including sports like golf, tennis. Some patients get back skiing, but it's really giving their quality of life back and getting them back doing the majority of things that they want to do.
Will that joint last a lifetime?
So we don't know yet. So the older models that we're using, we're getting 15, 20 years out of them pretty consistently. We have improved the technology significantly over the recent years. We're still waiting on long-term data to come back, but we're hopeful that these new joints are going to get us longer amount of time to the patients.
Yeah, wonderful advancements that are allowing for a quality of life for people who live with a great deal of pain. I know. Okay, Dr. Sherry, thanks so much. And folks, if you want more information on Spectrum Health Orthopedics, go to 13onyourside.com. Thanks, Dr. Sherry.
Thank you so much.